So here's a case of a 40-year-old female who came to my office complaining of lower back pain. The pain is only there when standing, and it's been there for 5 years. So nothing's really helped it. She also has some neck pain that comes and goes, constipation, and occasional dizziness when standing. So some of the most important clinical findings that I found in the initial exam are a difference in the systolic blood pressure from left to right. You can see that it's a difference of about 8 points. So I think that really any difference I pay attention to, but generally 10 points or more is more significant. Heart rate, 72 seated and 92 standing. So that heart rate does tend to climb. So um, in her case, I just categorized it as just a mild potential POTS condition. Now, looking at the findings, you'll quickly see that most of the findings that I found are right hemisphere findings. I put left cerebellum there, but it's really primarily right brain findings. Reduced left arm swing, which improves with dual tasking. Left finger tap is much slower than the right, and it progressively gets slower as she continues to do it, and the amplitude keeps on reducing as well. Left finger to nose, past pointing, only 1 out of 3 challenges. Left shoulder tone is much higher, so she's got more stiffness on that left side. Some of the other findings are I categorize them as right hemisphere, right pons, and medulla. So she's got a right palatal paresis, she's got a right tongue deviation, and a right pyramidal distribution of weakness. So right there I'm thinking there's a PMRF involvement in this case. Sacudometry testing was performed. She has, as you can see here on the green line, she has a right hypometria. Classically, I personally expected to see left hypometria to go along with the right hemisphere, the right frontal lobe. But that's not what I got. I got a right hypometria. There's a few on the left, but it's clearly mostly the green lines, which are left brain. And you'll see that where that little pack is there at the end, that's where all the lines should be together. She's got a left velocity is faster, so the red lines, you see, they go higher than the green ones. They're both, I would say, normal. They're both in normal range, but what's not normal is that they're not together. Okay, so they really should be running together. So you see that top one right here, the red, and that top one here, the green. They should be all bundled in a group together. So let's take a look here at my thought process here in addressing this case. So at this point I realize, okay, well we clearly have a right brain lesion here and a right PMRF lesion, which is affecting her autonomics and her heart rate. Cerebellum, typically with lower back pain, I automatically suspect, well, there could be right or left or both. And in this case, according to the sacudometer, I'm getting, from the sacudometry, I'm getting hypometric saccades to the right, which is really involving that right cerebellum. It's the right cerebellum that would allow the brain to accurately move the eyes to the right. And she did have past pointing on the left, and I'm attributing that to, a most likely a right parietal lobe issue, but potentially some left cerebellum. So I really want to do, in this case here, I want to do some bilateral cerebellum activity to help her with her back pain. So generally, complex movements of both legs are very good to do for most cases of lower back pain. And there's not as much of a unilateral representation when it comes to the spine. And so bilateral leg infinities or complex movements can be very beneficial. So the first 4 weeks of treatment, I was very mindful of the dysautonomia. I want to make sure to get that under control first, and that's always a wise first step to take. So what I did is I did some insufflation in the right ear in the office, as well as she would also do it at home. So she got a device to do it at home. Right ear insufflation, I would do it for about a minute, 3 reps each visit, and she would do that at least 3 times a day at home. Right pursuits, 10 repetitions, 3 sets. Those were appropriate for her. She was able to do them. The reason why I picked the right pursuits is primarily because of that right brain and right pontomedullary involvement. So I'll show you in a picture in just a second exactly how that works. But in this case, when you're dysmetric on the right side, if you do a pursuit, whether it be a head pursuit or an eye pursuit, they have the potential to improve accuracy of saccades to the right. And we did the bilateral leg complex movements and some other things, 2 other treatments I just wrote down in there. They're not necessarily important as it regards to the brain specifically, but for your information, we did some flexion distraction, some spinal decompression daily, so she would do it in the office as well as at home with a home device, class 4 laser to reduce inflammation in the lower back and the spine. And she would do Spine Force core conditioning, which is Spine Force is a machine that's got a movable platform that the patient stands on with big arms that you do isometric or isotonic exercises as well. So it's very good to strengthen the core. Now, that went on for 4 weeks. Right brain signs cleared. Right pons medulla signs cleared as well. Sitting heart rate is now 74. Standing is 75. Very stable. So now at this point, I'm transitioning to a slightly different plan now that she's stable. I'm now doing bilateral right and left brain eye movement training. So the right and left brain Carrick exercises basically. So we're going to be saccading up and pursuing down on a diagonal plane, and bilateral leg infinity. So I want to show you what this looks like, and she's doing very well, by the way. Let's take a look here at what that looks like. Actually, what I'd like to show you first I'd like to show you first just this image of my reasoning for picking that first, that right pursuit. You'll see right up here on the right, I put some of my findings here, which are right brain findings, and here we've got some right pons and medulla findings, and we also have some right cerebellum. So there's a lot of right-sided lesions involved in this case. And so if I want to do something that will help the right brain and the right pons, let me clear that a little bit, right brain and right pons, then it would have to be a rightward pursuit. And we know, the saccades are hypometric on the right, so it makes sense to use a pursuit, and that would help to activate the right parietal lobe and the right pons. So there we have that. And let me show you now on the Focus Builder app what that looked like. So the right pursuit, we'll go to the right, and I'll just leave the settings as they are here so you get to see that here, right pursuit. So this would be a pursuit, I'm sorry, if I'm looking at this as to the left, So I want it to go to the right, so to the right here. Okay, here we go. That's a right pursuit. And she would do 10 repetitions like that. And eventually, we switched to that combination saccades and pursuits. And in her case, I'm having her go in both directions. So here, this is for the left brain. And then I would switch it in the other direction. So I would have her do multiple reps, slow down that pursuit a little bit, do multiple reps, and do it bilaterally. Okay. Now, one thing I want to also mention before we close here is going back to the notes here. I want to show you the graph. I don't know if you might remember, but that last graph that she had, much improved, much cleaner, and you'll see here at the bottom that they're much more accurate. They really should be landing between that 18 and 22 margin, but there's still a little bit of a separation. You can still see here you've got green at the bottom and red at the top. So at this point, I'm actually considering switching to only doing a left brain eye movement therapies, just to get those greens under control. So I'm thinking about it, but I'm not going to do it right away because she's making such progress. I'm going to wait to do another graph and see if this is resolving, and if it's not, then I'm going to really emphasize on that left hemisphere for a little while and see if we can clean it up a little bit more.